Did you know that certain foods can make arthritis conditions worse? In this video, we will explore the 10 foods to avoid if you have arthritis and joint pain. Also, we will delve into the underlying causes of inflammation and joint pain, and discuss the most effective solutions to address it. Arthritis is a prevalent medical condition marked by joint inflammation, swelling, limited mobility, and discomfort. Arthritis encompasses many conditions, with over 100 different types identified. However, the most common kinds are osteoarthritis and rheumatoid arthritis, with osteoarthritis being the most commonly observed. It is characterized by the gradual deterioration of cartilage in the joints. The degeneration can occur over time due to injuries or regular wear and tear. On the other hand, rheumatoid arthritis involves an autoimmune response, leading to joint inflammation and potential impact on other organs in the body. Another type of arthritis is psoriatic arthritis, which affects individuals with psoriasis, a skin condition marked by red patches with silvery scales. Another painful condition, gout, is caused by an accumulation of uric acid in the joints, primarily affecting the big toe. While each type of arthritis exhibits unique symptoms and has specific risk factors, inflammation is a common factor contributing to their development. Let's kickstart this video with the 10 worst foods for arthritis by uncovering the first culprit that can exacerbate your joint pain. And then along the way, we'll embark on an exciting quest to unveil the true unyielding cause of inflammation in arthritis. Number 10 is trans fat and vegetable oils. Vegetable or refined seed oils are commonly found in our kitchens and restaurants. They sneak into our meals and hide in packaged or processed foods like potato chips, hot dogs, fried chicken, and salty snacks. But why are these oils so detrimental? Well, they contain high levels of omega-6 fatty acids that are prone to oxidation when exposed to heat and light. Oxidation is like a dark cloud over these oils, making them go bad and wreak havoc on your gut linings, joints, and blood vessels. This leads to inflammation, chronic pain, and overall discomfort. And there's even worse from vegetable oil, artificial trans fats. Look out for them under the label partially hydrogenated oils. These trans fats can be found in vegetable shortening, which is used in puffy pastries, fried fast foods, microwave popcorn, margarine, and non-dairy coffee creamers. To combat inflammation, you need to kick these harmful oils to the curb. Instead, embrace healthy fats like avocado, extra virgin oil, coconut, macadamia, and grass-fed butter. While inflammation is commonly attributed as the culprit, there's more to the story than meets the eye. Before we proceed to the next food to avoid if you have arthritis, let's delve into the underlying cause of joint pain. The true cause of joint pain in arthritis lies in the excess accumulation of fibrin around the joints, leading to chronic inflammation and discomfort. But what exactly is fibrin? Fibrin is an insoluble protein that plays a crucial role in wound healing and in the foundation for blood clots, scabs, and scars. A cascade of reactions is triggered when your body experiences any form of injury, even minor ones like bumps, scratches, or sudden temperature changes. Firstly, white blood cells are dispatched to the affected area to combat infection, resulting in inflammation and swelling. Secondly, fibrin is released to create a robust, mesh-like structure that seals off the site and initiates the healing process. The mesh is vital for capturing platelets and red blood cells to form blood clots. Normally, the excess fibrin is broken down once the injury is healed and inflammation subsides. However, in arthritis, fibrin continues to accumulate in the blood vessels and connective tissues surrounding the joints. This excess fibrin thickens and hardens, forming scar tissue that hinders blood flow and oxygen supply. Consequently, the healing process slows down, leading to prolonged stiffness and pain. This explains why pain medications become less effective after a while. Moreover, the impact of fibrin extends beyond the joints. It hampers the circulation of red blood cells to crucial areas, forcing the heart to work harder and elevating blood pressure. Elevated levels of fibrin in the body put it at a higher risk of stroke and heart disease. Before we unveil the secrets of breaking down fibrin, let's look at the next food to avoid, which is in the form of a liquid. Number 9 is alcohol. It might be tempting to turn to alcohol for pain relief and stress reduction when dealing with arthritis. Still, it can negatively affect certain arthritis medications and worsen your symptoms. It also acts as a diuretic, causing dehydration and intensifying joint pain and stiffness. Moreover, alcohol increases inflammation in the body, further exacerbating the condition. Surprisingly, the evidence suggests that alcohol may actually cause more harm to joints than it provides relief. If you have arthritis, it's best to avoid alcohol altogether or limit your intake. Moderation is the key, with 1 drink daily for women and 2 for men, ideally consumed with a meal. Remember to accompany each alcoholic beverage with a glass of water to slow down alcohol absorption and maintain hydration, preventing excessive dehydration. Have you ever noticed your joints aching after indulging in a pizza feast, munching on bagels, savoring cookies, or treating yourself to donuts or pasta? Well, there's a reason behind it. Number 8 on our list is refined carbohydrates. Refined carbohydrates swiftly break down into sugar, causing a surge in insulin levels that trigger inflammation, much like soda does. To curb this unwelcome inflammation, it's advisable to swap out white bread and pasta for healthier alternatives, like whole grain bread and sweet potatoes. Here is another liquid that is sweet but detrimental if you have arthritis. Number 7. Soda and sugar. With its high content of refined sugar, soda has been proven by research to have negative effects, particularly on osteoarthritis. Soda consumption causes blood sugar and insulin levels to spike, increasing inflammation throughout the body. Also, sweetened beverages like soda often contain high fructose corn syrup and empty calories, contributing to weight gain and further intensifying arthritis symptoms. To combat inflammation, it is recommended to replace sugary beverages with unsweetened tea or water. So let's make a toast to quenching our thirst with healthier choices. Now, there's something adding flavor to our food. It can be detrimental sometimes. At number 6, we have foods that are high in salt. Salt, a vital mineral, plays several important roles in our body. It helps maintain blood volume, balance the body's acidity levels, regulate blood pressure, facilitate muscle contractions, aid digestion and nutrient absorption, and regulate water balance. However, excessive salt consumption can have negative consequences. It can contribute to high blood pressure, putting you at higher risk for stroke and heart disease. Also, a high sodium intake is associated with osteoporosis, as it promotes calcium excretion in urine, leading to a loss of bone density. It's crucial to be mindful of our salt intake and opt for healthier alternatives to reduce the risks associated with excessive sodium consumption. Do you know that even structural protein is bad if you have arthritis? Number 5 is gluten. If you have gluten insensitivity or celiac disease, your body may react to gluten consumption by triggering an immune response that can cause joint pain and other symptoms. An interesting study published in the Oxford Journal of Rheumatology found that 41% of participants with rheumatoid arthritis experienced improved symptoms when following a gluten-free diet. Gluten is a protein found in barley. If you suspect you have gluten intolerance, you can eliminate all gluten-containing foods from your diet for 2 weeks. Pay attention to the changes in your joint pain during this period. Then, when you reintroduce gluten, observe if your joint pain worsens. You can make an informed decision about its inclusion in your diet and potentially alleviate joint discomfort. If you have arthritis, it's best to avoid food that involves frying, grilling, or broiling, which will lead us to the next food. Number 4 is AGE-rich foods. AGEs, advanced glycation end products, are a type of molecule that forms when sugar reacts with proteins or fats in a process known as glycation. These are primarily formed through cooking, especially at high temperatures like grilling or frying. Certain foods like dairy products and beef and dairy products also contain AGEs. Although AGEs have been associated with various health issues, including arthritis, diabetes, Alzheimer's disease, and kidney failure, there is limited evidence to suggest that they directly cause these conditions. Studies exploring the impact of AGEs on arthritis symptoms and joint pain are scarce, making it challenging to determine whether avoiding foods high in AGEs would alleviate these symptoms. Moving on to number 3, dairy products. While it is true that a few persons with arthritis can tolerate dairy products in moderation, many others find that they experience symptoms of inflammation and pain when consuming them. If you have an inflammatory type of arthritis, like psoriatic arthritis or rheumatoid arthritis, It is generally recommended to avoid all dairy products. These types of arthritis are characterized by an immune system that mistakenly attacks healthy joint tissue. Consuming dairy products can stimulate the production of more antibodies that target invading pathogens and attack healthy joint tissue. This can exacerbate joint discomfort and worsen symptoms. Do you know that generally it's good to always eat fresh food? Well, let's check out the next food. Number 2. Red meat and processed meat. Although red meat may not immediately seem detrimental to arthritis, it is high in saturated fats. Consuming saturated fats can elevate cholesterol levels in the bloodstream, potentially leading to heart disease, which can further worsen arthritis symptoms. Also, red meat contains substances like carnitine that, when consumed excessively, can trigger joint inflammation. Processed meats like bacon, hot dogs, sausage, and deli meats are products derived from animals that have been cured or smoked before being sold. These products often contain preservatives called nitrates, which prolong their shelf life and prevent discoloration. Nitrates have been associated with cancer development due to the production of carcinogenic compounds when exposed to heat. Research has indicated that consuming red meat increases the risk of rheumatoid arthritis, osteoarthritis, and cardiovascular disease. Additionally, red meat is rich in iron, and high iron levels can worsen existing joint problems by increasing the presence of free iron in the body. It is advisable to consider healthier alternatives and reduce the consumption of processed and red meats to support joint health and overall well-being. And finally, we reach the number 1 food: nightshade vegetables. People with joint conditions such as rheumatoid arthritis, osteoarthritis, or gout may benefit from avoiding nightshade vegetables like tomatoes, eggplants, potatoes, and peppers. These vegetables contain alkaloids that can lead to inflammation and pain by promoting the accumulation of calcium deposits in tendons, ligaments, cartilage, and joints. Now, how do we address the root cause of arthritis? The answer lies in using proteolytic enzymes. Proteolytic enzymes, also known as proteases, are crucial in breaking down proteins into smaller, more manageable units that the body can effectively utilize. The key takeaway is that these enzymes have powerful anti-inflammatory properties and are essential for a pain-free life. One of the primary functions of proteolytic enzymes is to break down excess fibrin found in the circulatory system and connective tissues, including muscles. By targeting and breaking down fibrin and scar tissue, proteolytic enzymes facilitate the delivery of oxygen and nutrient-rich blood to affected tissues, facilitating the excretion of metabolic waste that contributes to pain and inflammation. While the body naturally produces proteolytic enzymes in the pancreas, their production significantly declines after age 27. Therefore, it is important to obtain them from dietary sources or supplements. Pineapple and papaya are 2 excellent food sources for proteolytic enzymes. Papain and papaya and bromelain from pineapple can effectively reduce symptoms of pain, swelling, and joint stiffness in individuals with arthritis. Other foods rich in proteolytic enzymes include kiwi fruit, ginger, figs, asparagus, fermented foods such as sauerkraut, kefir, yogurt, and miso. It is worth noting that while incorporating proteolytic enzyme-rich foods into your diet can be beneficial, it may not be sufficient to boost enzyme levels significantly for pain relief. Therefore, considering a recommended proteolytic enzyme supplement may be necessary. Remember, proteolytic enzymes offer additional benefits such as easing sore muscles, promoting wound healing, regulating blood pressure, enhancing the immune system, and combating viruses. To summarize, to alleviate arthritis pain, consuming more pineapple and papaya, which are rich in proteolytic enzymes, is recommended. However, note that this information is educational and not a substitute for medical advice. So, consult with healthcare professionals for personalized guidance. Thank you for being so patient up to this point. It is greatly appreciated. Subscribe and enable alerts to avoid missing out on future videos from us and much more. Check out this video to learn more about how to care for your body, and we'll see you in the following video. Stay safe.